Welcome, everybody. I'm very happy to be able to talk to you today about the Cochrane Library. And I want to go over the library itself and the systematic reviews in a kind of very brief overview, but then also to focus on a number of other resources that Cochrane now makes available. Some of them within the library itself, and others are more publicly available through the Cochrane website at cochrane.org. So I'm going to use just the slides for this, so each of the different pages are going to be somewhat static, and if you're interested in these particular resources, it would be good to get on the Cochrane Library or the Cochrane.org website and explore things there yourself, because with all of these online resources, it's often best to kind of just wander around and look at the various things and try out some of the different tools that they have available there. So I'm going to move on. Thank you for those who have shared your answers to the poll questions there. That gives me some sense that we've got people who are somewhat familiar all the way up to really familiar with the Cochrane resources. So the Cochrane Library is a completely online resource. This was a decision that Cochrane, as an organization, made early on in the early 90s when it was first founded, that they were not going to publish in hard copy, but completely electronically. And so the library is available online. And first of all, just if you're not familiar with connecting to the Cochrane Library, in the US, the library is not publicly available through any website or browser. Actually, in Ireland was the first country where the technology was figured out to allow everybody to have open access to the Cochrane Library from any browser or terminal within the island of Ireland. And this is actually how most countries make the library available through subscriptions paid for by their ministries of health or government funders. But in the US, it's actually provided through institutions, medical centers, universities. And so those of you who are joining as part of the FOLD immersion program, which is one of the evidence-based practice programs provided by the FOLD Institute for clinicians, you will have a subscription for a time through the Ohio State University libraries that will allow you to access the library via the University Health Sciences Library, and then others of you joining from other institutions will need to go through your institutional libraries. But once you're in, then the library itself has a simple searching tool, and so I thought we would start there. And just with the concern about COVID-19, I just used the example of hand washing. And what the library brings up then, and part of my purpose here today, is in looking at the fact that there is a tab for the Cochrane reviews that a simple search will pull up, but that there are a number of other tabs that we're going to look at and explore. But to begin with, I also want to mention that an advanced searching feature is in the library as well. And it's important to be aware of this when you're looking for more specific information. So I put together a more detailed search here that you can see through the various ways that you can enter additional terms. So in addition to the hand washing going in under the title abstract keyword, you can also add various other boxes, and you just do that through hitting on the plus sign here. You can keep adding more and more. And then adding, for example, a specific author whom you're interested in, John Smith, a particular type of publication. So in this case, you just want systematic reviews. And with the Boolean characters of not and or, you can use those. And so let's say you're looking for community-oriented practices, you can say not hospital-based. The other thing, and so this will help to limit the search for specific resources you're looking for. The other thing that the advanced search provides is other ways of doing the search, and I'm not going to go through these in detail. But for example, there's the search manager where you can organize the whole search and then save it in ways of collecting the various lines of the search that you would have. You can also search using mesh headings. So these are the database categories that are used. So for example, you can look up the mesh term that specifies a particular illness or particular intervention, and then search under that to ensure that you identify the most specific resources. And then Cochrane has just developed or is developing a way to search using the PICO terminology. So this is the population, intervention, comparison, and outcomes type of search. Just a quick notice there of the different ways of doing searches that are available through the advanced search. And while the simple search can be useful if you need something really quickly, it's important to remember that there are these other ways of being more specific and selective in the searches that you do. So going back to the results that you get from doing a search in the Cochrane Library, there's first of all the category of Cochrane reviews. And so this will pull up any of the Cochrane reviews that have been done that include the search term. And so you see here that there are 6 Cochrane reviews, and they will then be listed below. So you can then click on that, and it takes you to the first of the reviews here. And I just want to give you a brief overview of some of the ways that the information is presented here. So you can access the complete review here once you're logged in through your institutional library. And one of the things that is kind of relevant internationally is that now Cochrane is really pushing to make all of its reviews available in a number of languages. And so it will tell you when there are additional languages that, for example, here the abstract is available in English, French, and Chinese. And the review will start with, as with any kind of professional publication, with the abstract. But what may be particularly useful for people who are busy as clinicians or policymakers, patients, is all of the reviews have a plain language summary. And these are available usually in additional languages for international use or use within clinics where you've got different languages spoken. And all of these plain language summaries are reviewed by the Cochrane Consumers Group so that they are written for non-professional audiences. And they will give a very clear and kind of non a professionally oriented summary of the main findings. The conclusions are always presented with the implications both for practice, so that as a clinician you can quickly see what the overall conclusions are, and then for research, so that if you're approaching this as a researcher, you can identify ways that this review is recommending that further research be done, or that certain types of approaches to additional research is needed. On the right side of these pages, you can see that you can get access to various parts of the full review itself. And then following on from these conclusions, you will find the summary of findings tables. These are now being added to all new reviews, and then as older reviews are updated, they will be added in at the updating stage. But these are intended to give very quick overviews of the detailed information that's available in the review. The other thing is that these summary of findings tables are developed around the outcomes that may or may not necessarily be addressed in the review itself or in the original studies that are found there, but are regarded as the outcomes of most interest to clinicians, patients, or policymakers. And so you see, for example, in this particular one, hand washing at child daycare centers and schools compared to interventions. One of the things that was identified ahead of time as being significant was how interventions impact hand washing behavior. And unfortunately, in this particular case, you see that there isn't any data to guide people there in terms of the numerical information. However, in the episodes of diarrhea, that there is sufficient data. So this is one of the ways that Cochrane is trying to ensure that outcomes that are of most interest to users of reviews are getting highlighted, and that hopefully this will then lead researchers who see that there are gaps here in the available information will be inclined to start to include those outcomes in new studies that are being conducted. These summary of findings tables are developed according to what is called GRADE methodology. And so this includes a way of ranking the quality of the evidence that's available, so that, again, users of the reviews can quickly see, as you can tell here on the right-hand side of this table, that the quality of the evidence around high-income countries is high. And so this is based on the outcomes, the results of the trials, the numbers of participants, the numbers of trials, whereas the quality of the evidence coming from low and middle income countries is low. And so this then will affect the strength of the recommendation that can be made as people try to put this into practice or into policy. So this is, these parts of the systematic reviews are part of Cochrane's major emphasis these days on making sure that while the reviews themselves contain large amounts of information and very detailed reviews of all of the original research, that there are also summaries provided that are accessible immediately at the top of the reviews and are geared to being as useful as possible to the users of the reviews. So going back to our original search under hand washing and to look at some of the other tabs that are available here, we've looked at the Cochrane Reviews one. Cochrane Protocols is where there are reviews that are being conducted at the moment, and the protocols have been reviewed. So these are ways that the teams are currently working on carrying out reviews. And so while there are not going to be results available at this point, you'll be able to see that a review is underway and have some sense of when that is going to, those results are going to become available. The next tab is for trials, and so this is an additional database within the library called Central, and this is now the largest database of randomized controlled trials in anywhere for health research. And so as Cochrane reviews are carried out, any randomized controlled trial that's identified will be added to this database, and it's now searchable, so that if you were looking for original studies or wanted to explore, to find summaries of other trials that have been carried out, this is available within the library. There's then also editorials to get commentary on the topic that you may be interested in. And then Cochrane, again, in their attempts to try to bring together topics that are of special interest and bring together a number of different reviews that may be related, they've developed a series of special collections, which is continually being added to. And turned out in this case that hand washing doesn't kind of lead to its own special collection. So I looked up some other special collections, and there are now 2 available on the COVID-19 coronavirus outbreak. And so this is again part of Cochrane's effort to make this its evidence available as rapidly as possible, and bringing together whatever resources they have available for a particular either crisis, as in the pandemic, or a topic of interest, as in other areas. So what they do in these special collections then will give you a summary of the areas that the original Cochrane reviews are found in, and will then summarize where they have collected this information from, and then in the page following down from this screenshot, they then list off the variety of different Cochrane systematic reviews that are relevant to some dimension of the coronavirus. So they have grouped these into 2 special collections, one focused on the infection control and prevention measures, and then there's a second special collection related to critical care of patients with these types of infections and the symptoms that come with those. So that's another resource within the library. Then another database is not part of the Cochrane Library itself, but is searched as part of doing a Cochrane search, is a database that contains all sorts of other published systematic reviews. So this will look at ones that have been published in academic journals or on other institutional websites, and will give you access to a list of those reviews which you might want to refer to, especially if there's not a Cochrane review on the specific topic that you're interested in. And then Clinical Answers is another resource within the library, and I'm going to move to what this provides. So this is after a Cochrane systematic review is published, the team that produced the review will work with other editors to develop a question that is probably most relevant to clinicians that the systematic review will provide clear answers to. And so in this particular case, the clinical question was, what effect does the promotion of hand washing have on the incidence of diarrhea in children? You then get a one-paragraph answer to that question based on the evidence that was in a particular Cochrane systematic review. And then beneath this, the rest of the documentation will provide other details from the systematic review to allow readers to follow up on specific details that are available within the review. So the aim with this database of clinical answers now is to make available the questions that clinicians are most likely to be asking, for which there are clear answers within the Cochrane Library. You see that on all of the Cochrane Library pages, there is a link to these clinical answers themselves. And so when you click on that, you're able to both browse the clinical answers themselves, or to find more details on how these are put together, or how you can request that a particular question be addressed in one of these formats. So you can see here, this is the complete list of the clinical answers. There's just over 2,000 of these, and they have been organized into various topics. Then you see the first of these listed down here under child health, heart and circulation, infectious diseases. And there are about 30 other topics that are addressed through these. And so you can search through a particular broad area to try to identify whether there are some clinical answers that are relevant to your interests and area of practice. So this is where I want to go on beyond the library itself and talk about some of the other resources that are available. Most of these are through the Cochrane.org website. It's more generally available. And this is where on the Cochrane.org website itself, you can access and search all of the library's plain language summaries here. So this is for people who don't have a subscription or access through an institutional subscription to the full library itself. You are able to access, well, both search and access all of the plain language summaries through this part of the website. Recognizing that many people don't have the time to read, or have additional travel and commute time, that they can listen to information that Cochrane is continuing to produce. There are selected podcasts published every week, every month. The library comes out with a new batch of reviews every month, and some of these are selected to have the authors record a podcast, and then these are made available to download. There are now several hundred of these, and through this page you're able to search by the title of the podcast, if you're aware of that, or you can put in a more general search for the description. The other thing again is that these are increasingly being made available in a variety of languages, which may be helpful, particularly the Spanish language ones that for the US. For those of you that might find a systematic review that's particularly useful to your area of practice or the team that you work with, the Journal Club is a way that the team that produces the Cochrane systematic reviews will then be asked to put together a set of resources that would allow somebody to really just collect a group of people together to have a journal club discussion, maybe over lunch or something else, and really have very little work to do in preparing for this other than find a place and get a group of people together. So the resources that are provided for the reviews that have a journal club resource would include slides, if that's something you want to do, some some sheets to provide questions to encourage group discussion, summaries of the reviews, and a variety of other handouts and materials that can be used to help guide and facilitate a discussion around one of the Cochrane reviews. So these are made available on, at least one is published every month, and those you can sign up to receive the updates on which ones are available through that URL. This whole initiative was started by the Schizophrenia Review Group, and they continue to have the largest group of these journal club resources and are available through the additional website for the Schizophrenia Review Group itself. Another resource is for those of you who are teaching, are a collection of resources and learning activities which would allow you to bring some exercises into the classroom or a small group discussion, and help to provide students with practical learning activities that expose them to either the use of a Cochrane systematic review or to the conducting of a review. And so these are everything from exercises that would take just 5 minutes to add to a classroom setting, to longer group activities that could allow a group within the class to work on it for a whole period. So these, again, are a resource that continues to grow and develop, and so you can explore those through that particular link there. Cochrane is also continuing to innovate and provide new resources, both for those who are conducting systematic reviews, but also those who are users of reviews. And so they have brought these together into what's called Project Transform. And so this is a collection of projects that are continually changing. And so, for example, the one that's in the middle there called Task Exchange. So for people who, say, are doing a Cochrane systematic review, and let's say they have identified a large number of abstracts and need some help with others screening those abstracts to identify the relevant articles to be reviewed. They can then somebody can put in a request there for assistance. You see here that Classmate is something here that is down in the left corner. So again, this is something where maybe you have an idea for an exercise that you'd like to bring in, something more generally around evidence-based practice in a classroom setting. But you need some people to help you develop it, or to maybe put together some kind of resources or images, graphics to help you with that. That's an area then that you can put in a request for that and get help with that. And you see that over on the right-hand side, there are a number of different ideas that have been put out there, that resources are being worked on. And there are ways then that you can either propose to get involved in helping out, or put in a request to say, I need help on either using or writing systematic reviews. So in the past, Cochrane membership was restricted to those who were authors of Cochrane reviews, which means that you had to commit to actually writing a Cochrane review in order to kind of get the access that membership provides. Cochrane has now, just in the last couple of years, changed this, and membership is now available at a variety of different levels. And what is needed or required in order to become a member is to make a commitment to, in some way, contribute to the work of the collaboration. I think it's important to remember that while the collaboration has about 30,000 people working on Cochrane reviews throughout the world, only a very small number of people, I think it's probably certainly down in the hundreds, are actually employed to work with Cochrane. Almost all of the people involved in Cochrane are doing so on a voluntary basis. Most of them are clinicians or academics or involved in various healthcare organizations, and see involvement in Cochrane as a way to contribute to the evidence that's available, either in helping to write Cochrane reviews or in finding ways to make their evidence more user-friendly and available to others. So what membership now involves is where you can sign up and say that you're prepared to get involved in, for example, screening a number of abstracts each month, and various numbers of abstracts can be added to there. Or maybe you want to get involved and would like to learn how to actually go through and evaluate the inclusion and exclusion criteria for studies to be put into a review, or get involved in sort of contributing the types of classroom exercises. There's a whole variety of different ways, all the way up to becoming involved as an author, or if you've got much more experience clinically or in reviewing, to becoming a peer reviewer of Cochrane systematic reviews. There's a whole host of different levels of activity that can be signed up for. And with this then, membership will bring initially access to training resources and materials, so that you can get the training that's necessary to be able to carry out the types of activities that you're available to conduct. And then as you are involved in the collaboration, you're then able to access other training so that you can prepare yourself to be involved to further degrees, if that's something that really interests you. So if that is something that you'd be willing to consider, there's the website on how you can join, and it'll provide there the details on the types of commitments that are involved there. So that's my kind of formal presentation of the types of resources that are available within the library, and then through the Cochrane website itself more broadly. I'm now happy to take any comments or questions either through the chat or by opening up your microphone and asking it verbally. And as well, you can see here that there's an additional poll that provides a few more questions that will help us to see just kind of what sorts of resources here are you likely to be interested in learning more about. So let's turn it over, and I believe Bindu is going to help to moderate the chat questions or the oral questions. So
it was very informative. I'm wondering with this, what was it called? The project Transform?
yes.
There's this task exchange where it seems like people can take on different tasks that are suitable to their skills, and then other people take on other tasks. Can you tell us a little bit more how that works?
Yeah, that's so you go to that the Project Transform website. That will give you a link over to the task exchange, and then it's from there it's really kind of like a moderated chat or a blog that's available so that people can just put in a request there. It'll be moderated so that if someone at Cochrane says we need some more information, or they will respond to that. But then it's a way that the question will go out to the people who have signed up for information to receive requests, and will then be able to get a response, so that if you're looking for help with doing a systematic review on a certain topic, and you've got certain criteria that you need somebody with a particular clinical background, and you'll get the feedback in terms of people who are willing and available to kind of help you with that. I know people who have used it to identify people interested in doing a systematic review, where they had a topic but didn't have a large enough team to be able to do all of the work themselves. So it's sort of like a a blogging site that allows you to request help or access to other resources, or just answers to specific questions.
Mm-hmm. Okay, thank you. And it seems to work well. Like, questions get answered, and
yeah, it does. It seems to, it has a pretty active group of people that I've not heard of people's requests just sitting there unanswered for long periods.
Okay, great. Thank you.
So we've got a number of chat questions.
There's a lot of curiosity about the Cochrane classmate option. Donald, if you can talk a little more about that.
Yeah, it's actually, it's a pretty new resource, so I have not talked to anybody who has used it myself yet. But what I've taken a look at it, and there seem to be fairly straightforward, simple exercises that you could add into a class on any area where it would be relevant to look at, well, how do we find the evidence, or what evidence do we need to use in the topic that we're looking at, all the way to more specific questions around or exercises around doing a systematic review in terms of identifying the PICO questions, or principles of putting together a search strategy. So those sorts of just very kind of useful exercises targeted to specific elements of the whole process of. Thank you very much for coming along, everybody.